population numbers are versus white America, and the red bar shows you the number of people that participate in clinical trials. So that's 75%, that's white America. They're there. And usually it's white men. So not only do I do diversity, but I'm pushing with this idea around inclusion because women, period, have to be accounted for. When you move through this chart and you look at Hispanics, only 1% of the Hispanic community participates in clinical research. Only 7% of African Americans. And Asians are participating now at a rate of 11%, and it's growing. So what does all of this mean? When we look at the projections for population growth, by the year 2044, minority groups will not be the minority any longer. And what does that world look like if we're outnumbering Caucasians, we're growing old, we have ailments, and there's no medication for us? So we're now having to face the fact, the honest fact, that our world is changing. Genders, minority groups, ethnicities, it all is going to impact in the end when we're looking for the right treatment to help us through our journeys. So Brittany touched on this as well, women of color, and lupus is just one of the conditions that we're being attacked by. 90% of the diagnoses of lupus are women, and African American women are 3 to 4 times more likely to have or be diagnosed with lupus. So we've got to figure out what, why, how do we get in front of this? And it's up to us to keep pushing and asking the questions and participating. So I've had a chance to talk with some of the physicians who actually created these studies. And they look at me and say, I hear you, but I don't know what to do. When I look out into my research room, there are no women of color. It's really kind of sad at this point because they're getting closer, they feel like they have the right ideas, but they're testing it on the majority of white women at this point. Okay? So what's the Paisley study? That brochure in front of you is our lupus study that I just touched on that talks about this oral capsule. I wanted to walk you through exactly what a study looks like, just so you'll understand it. Whether or not you ever consider it is not the point. I want you to know when people talk about clinical research and clinical studies exactly what they mean. Okay? So the Paisley study, we're testing, I talked about this oral capsule. We're doing it in what we call dosing. So there's 3 different doses that any participant would receive. And of course, there's also what is referred to in the research world as a placebo. This is the one drug that's just general. There's no drug in there that actually helps. But we need to understand how, for those women that are taking the drug, it'll work. So a clinical trial, I talked about timing. I wanted to get to this. This is not an in and out sort of scenario. When you're participating in a clinical research study, you're talking about 56 weeks, and there's a reason for that. Again, we talked about the safety that is needed. We talked about wanting to understand what's happening. The only way we get to that point is to understand this process, and that process is in 3 phases, what we refer to as screening, treatment, and follow-up. So what happens with screening? Just because you might be interested in a clinical trial doesn't necessarily mean you can participate. There are criteria. You have to sort of meet what we call inclusion criteria. There's also this thing that's called exclusion criteria, because we never want to have someone participating in a research study when they may have a certain medical situation that is just not best to go through this process. All of this is what you would discuss during the screening phase. You're talking, it lasts usually about a month, you're talking to a team of people at the medical facility, and it's a conversation. They're getting a sense of what's happening with you, you're talking about what your concerns are, they're guiding you through what to expect. And it's actually before you get to the screening process, we even have a pre-screening process that if you don't want to go into a medical study, you can go to our website and answer some questions and automatically we'll see, yes, I want to participate, or no, I can't participate because I've had some chemotherapy recently. You'll be able to really guide yourself through it, but that's the piece that I want you to understand, the process of having a sense of what to expect and how to walk yourself through it. So the actual treatment phase is the long haul. It's about 48 weeks. You're going to the clinic, you're talking to the nurse, they're testing you. It's a total body assessment. Again, Key thing to remember, you never should be taking this lightly. This is about what's happening, this is how I'm feeling. Hey, I noticed my breathing is a little bit more labored, because guess what? If it's not helping and it's actually hindering, treatment stops immediately and everyone's good.